Selfcare, Person Centred and Holistic. Nowadays, as a nurse, you would be able to discuss the nursing problems you identified in the assessment process and talk with him about any deviations from health, any assistance he would need performing the activities of daily living. As part of the person-centered approach, the nurse would also find out what health aims Patrick would like to achieve and negotiate aims of care that were both realistic for the nurse and important to Patrick. Having identified these aims, the nurse would then work collaboratively with Patrick to identify nursing interventions and self-care interventions that could be implemented to achieve these aims. In the OSCE, it won't be possible to discuss a plan of nursing care with your patient due to the constraints of time, so the following activities can be used to show person-centered and holistic care when writing a care plan. Referring to patient by their preferred name when setting patient aims, using words that they choose to describe a problem. Referring to the activity that presents the main problem of the plan of care. Include problems related to what they were admitted with in one of the aims. Write self-care interventions where Patrick can use his strengths to complete activities that achieve the aims written in the care plan. Write a care plan that directs nursing care to be safe. Be specific about aims and level of expected dependency of Patrick. Write a care plan that is non-judgmental, respectful, and non-prejudicial. Self-care interventions. Patrick will use TV, magazines, crosswords to distract from pain. Patrick agrees to buzzer nursing staff as soon as he needs to mobilize. Patrick will verbalize understanding of the plan of care. Self-care interventions. Self-care interventions are activities designed for patients and their families to achieve the nursing aims. Patients need to be positively engaged in their own care for a nursing care plan to be optimal by negotiating nursing aims with the patient and supporting the patient and their family. Deciding on interventions, the nurse will empower the patient and increase their confidence in their own ability. Roper's model is holistic and believes that the patient should be nursed within the context of their family, encouraging the involvement of family members that care for the patient to contribute to care will reduce anxiety and improve the quality of their experience while hospitalized. It will also assist family members managing the patient's health problems after discharge. If the OSCE patient will be cared for by family members, interventions that will be completed by them can be incorporated into the self-care intervention. You will need to write a minimum of 2 good self-care interventions for each nursing problem. Recommended self-care interventions. Unlike the nursing interventions, there are no compulsory self-care interventions. It is recommended that one of your self-care interventions is that the patient gives their consent. For example, Patrick and his daughter state that they understand the plan of care and agree to actively participate. The reason for this is twofold. Firstly, it demonstrates to the OSCE examiners that the OSCE patient is central to the process. And secondly, it shows that you are obtaining patient consent where possible as per NMC code. Only self-care interventions are activities undertaken by the patient or their family, so they need to be written actively and not passively. For example, Patrick agrees to use the call bell to call the nurse prior to mobilizing, active. Patrick will use the call bell prior to mobilizing, passive. Patrick can demonstrate correct use of the pain scale 0 to 10.